Vedagiri Ganeshan sir. So about him, no need to introduce or no need to tell about him. Daily I have been telling a very extempore words about him. No doubt about it, his talent, so that everybody knows. Now, anyway, it is my bounden duty as president to invite him to this August gathering. As chairman, so as president, I am inviting him, and I am also inviting the so-called today's chief guest, Professor Madhumati from nice words. Now, I request Professor Ganeshan sir to go ahead with our program. Kindly, Ganeshan sir.
Yes. Good evening to everybody. Professor Govinda Reddy Garu,
Yes.
Sri Lakshmana Rao Garu, Dr. Krishnamurthy, and Professor Madhumati, and I think Dr. Chinni Simon is likely to come little later, and all participants. Today's topic is anorgasmia. First of all, what is orgasm? It is felt by women during sexual activity. They feel so happy at that moment. And anorgasmia means it is not happening to them. It is not a pleasurable experience for some women. And what is the reason for that? One reason may be the husbands of some of these women are not able to fulfill the orgasm. They are not able to give the orgasm to the partner. That is one part. Next is the minds of these women who are having anorgasmia. They switch off the mind and they give only the body for the sexual interaction. That means they don't like sex or they don't like the husband. In either case, they will switch off the mind and it is only a body which is available which will not experience any orgasm or satisfaction because it is not a body experience, it is a experience by the mind or the brain. So the brain will switch off and they will feel as if it is a dummy. The body feels like a dummy. And why it happens is because they have not preferred the husband and they had somebody in mind and unfortunately they got married to the present husband. That is one possibility. Another thing is they would have been sexually harassed when they were pretty young and the traumatic experience makes them to hate sex and feel that it is a horrible experience, it is a dirty experience. So the mind is switched off like that. So how to treat such people if they are married or if some women are postponing the marriage after the age of 25, 30, 35 because they do not like sex. Basically, they had an aversive experience, not necessarily to be sexually harassed by somebody, but even hearing the horror stories or looking at a picture, film, or reading stories, they feel that it is going to be a terrible experience. They want to escape from that. And if at all they get married, even if it is a late marriage, then they switch off the mind and they feel that I have nothing to do with this dirty job like that. So how to treat these people? So it is purely a psychological phenomenon which affects the body, the brain, etc. And sometimes they will become infertile. If they continue to be like that, they will not bear children. And also they will have miscarriages. If at all they conceive, they will have miscarriage. And they will be afraid of delivery. These are the complex situations for some women who are suffering from anorgasmia. Now, how to handle this case, how to make them to become all right is, first of all, they may have an aversion to males in general and naturally towards the husband also. So my recommendation is teach them self-defense. Why self-defense is because they should understand that the husband is not a villain but a hero. So they should not conceive the husband as a villain also, just because something happened in the past. So if they think it may happen again, and whenever the husband approaches, they feel that it is undesirable. So they should know how to hit a villain and how to hug the hero, who is the husband. For that, the self-defense technique is very, very useful, which can be trained by any self-defense expert available in the region. And in fact, it can be given to all schoolgirls and also to college girls. And it can be given to married women also, because we do not know who is affected. So it is better as a preventive measure, we can give it to them. And also, if at all anything negative is to happen, they will know how to handle, how to protect themselves, and also how to attack the offender. So that is one technique which I would recommend. Another thing is the genital muscle relaxation, which we have already discussed in prior sections. That is contracting the anal muscle, counting from 1001 to 1006 and relaxing, repeat it 20 times, 20 trials. Then contracting the vaginal muscles and relaxing, again repeat it 20 times. And both muscles, anal and vaginal muscles also, they can contract and count from 1001 to 1006 and relax. So these are the three things. Another thing, if they have a love affair and unable to forget, so what they will do is they will switch off their feelings during sex, because they wanted to marry somebody, but unfortunately it so happened they married somebody else. Okay, so this is also possible. And I would like the participants to actively get involved and pose several cases or questions or problems so that we can discuss. So it is more of an interactional program. So you can even present an imaginary case and you can do. Yes.
Sir,
Yes, please.
sir, good evening, sir. Suresh Kumar, sir.
Yes, yes, Dr. Suresh.
Sir, though they won't experience this orgasm, do they have the chances to get the conception, sir? Conceiving.
Yes, yes.
Do they have the chances to get conceived?
Yeah, conception is possible without orgasm.
Okay, okay. So
Yes.
that's why in the atrocity cases, female atrocities, though they are not interested and they got orgasm, but they may have the chances to get the conception, it seems.
Because what happens when the semen is let into the vagina,
Yes,
the
yes.
vaginal walls start squeezing it, and they will take the semen and deliver it to the mouth of the uterus.
Okay.
It's an automatic mechanical activity, just like we chew something and eat. Then the kind of movement starts from the throat,
Yes.
okay, to the stomach. It goes on pulling in.
Yes,
So
yes, yes.
constriction happens. But
Okay,
the
okay.
husband is not able to maintain erection for a fairly long time to induce orgasm.
Okay,
So
okay.
husband will be suffering from premature ejaculation. So the husband needs to be treated to maintain the erection for a fairly long period.
Okay. Right, sir. Thank you, sir.
And in fact, many women do not know that there is orgasm.
Yes, yes.
At least 33% of the men, they finish too quickly. They have premature ejaculation. So they don't experience orgasm even once.
Okay, okay, okay.
But then, how to create an orgasm? Okay, it is a mind job. Then I would suggest some technique for that.
Okay.
Little later.
Right. Right, sir. Right. Thank you, sir. Thank you.
Welcome. Yes.
Sir, is this like a frigidity, sir? Can we say that this is frigidity also, sir?
Yeah, rigidity, the body becomes stiff. It is known as a cold turkey syndrome. So if you keep a turkey, dead turkey in the fridge and take it, it will be pretty stiff. Okay, it won't be flexible. So some women, they have this kind of rigidity, or the body becomes stiff because they don't like it. Okay, then they will not experience any orgasm. Both are related. Okay.
Yes, sir. Thank you, sir.
Yeah, welcome. Sometimes the body becomes so stiff, and in some cases, the legs get paralyzed. So you would have studied long back in Page, the author is Page, Abnormal Psychology by Page. There, one case is reported where a lady becomes paralyzed and she is unable to move her legs. So she will be bedridden, okay, like that. The reason is she doesn't like sex. She has developed an aversion to sex. As a result, she doesn't like, so she says her legs are not moving because the legs have to open, So she says, I am unable to open my legs, like that. So that is also a psychosomatic illness, which manifests in paralysis, but the reflexes will be all right. So if the orthopedic surgeon knocks at the knee, there will be a jerk. Okay. If they touch at the sole of the foot, there will be the toes will be shrinking. Okay. So they say it is functional, it is psychological. They will refer them to a psychologist. But the paralysis will become all right if they mentally accept sex. Then the nervous system and the muscular system will be active and they will be able to work.
What is G-spot?
Yes.
What is G-spot? That they say that is most Americans say.
G-spot there is a controversy over that, but they say it is somewhere around, if you look at the vagina as a clock, it is at 50, 45 and 50. That is the place where there is a little bulging. And if it is touched by the penis, they have the orgasm. That's it. And then people start asking for whether they have a G-spot. But forget about it. There is no specific spot in the female body. The entire body is sensitive to sex. Even if the little finger is touched, a woman can have orgasm. Or even if the nose is touched, she can have orgasm. Okay, so that, but for the males, it is not so. The whole body, anywhere in the body of the woman, if it is touched by a person whom they like, they will have an orgasm. Or even if they see something, they will have an orgasm. But that's not a weakness. That is okay.
Thank you, sir. Thank you. Thank you for the.
You have suggested one of the reasons
Yes.
for not getting orgasm.
Okay. Okay.
So for such type of cases, as you said, perhaps the selection of the husband may not be as per the wishes of that girl
Yes.
who got married. Okay.
Yes. Yes. Yes.
So for such cases, premarital counseling definitely helps a lot.
Yes.
So,
Yes. Definitely. Definitely.
Yeah. So
Definitely. Yes.
So there itself, when likes and dislikes can be just open up, and
Yes.
they can,
Yes.
she can openly say that I am not interested. Better just choose somebody else. Like that, she
Right.
can openly tell as per the premarital counseling is concerned.
Yeah, that is true.
Otherwise, I have counseled these important cases, particularly
Okay.
boys.
Okay.
I said, you fellow,
Yeah.
you are having this problem, then why you have gone to go for marriage?
Okay. Okay.
That some of these bridegrooms are telling, no, I am not at all interested. My papa, my father, and my mother, because if they don't perform my marriage, so that becomes a stigma in this society. I said, you bloody fellow, you have no mind at all. Why do you bother about just because of your social stigma and social status? You are ruining one life. So don't you have common sense? I used to bang such type of student, bridegrooms also, sir. So this is the answer they are telling.
Yes. Yes. Okay.
Really,
Now,
having this fellow knows that he is important, but having known that he is experiencing such a bad situation, then why just he proceeded towards going for marriage? It is a question mark.
right. Yeah. So premarital counseling is essential to help them to come out of their problem. After that, they can go for marriage. That's
Yeah.
good.
Yes.
People should be aware that premarital counseling is available, given by psychologists. So we have to tell them.
Yeah, I counsel one case.
Yeah.
He is a carpenter in Tirupati alone.
Okay.
So he has only one daughter.
Okay.
So he has accumulated more than through labor, more than 10 to 15 lakhs. So because
Okay.
only daughter, he wanted to give it a better fellow, and
Okay.
his own objective is just his daughter should be settled happily. That is the
Yeah.
motto of any father. So
Okay.
with that objective, he just accumulated more than 15 lakhs. He searched people. So he searched a better fellow who is working in Tamil Nadu in railways, central government job.
Okay. Good.
That fellow is here just drawing more than 1.5 lakh. So what this girl did, she did not say, I am not at all interested. She agreed.
Okay.
Then marriage was over. Then problem arose in the first night. What she did, he is about to just hug that girl. She kicked him like anything.
Oh,
Hey, you fellow, you have no mind at all. So that means, like this from both male side and female side, these are all things going on. So that's why premarital counseling is quite
Yes,
essential.
I agree. Yes.
Good fellow, 15 lakhs he spent. Just he obtained a very fellow, good fellow. But what she did, she could have told to just her father. I asked, why you have not informed your father? No, sir. If I inform at that stage, my father will grumble against me. Now what you did? You just kicked that fellow in the bedroom first night. So is it just it is that fellow? So I had already a fellow in my mind. So why just I am not at all interested? You could have told just your father openly.
Yes.
She did not do that.
Yes. Yes.
In the first night in the bedroom, she did like that.
Right. No, like see, when somebody is appointed for a government job in the state or central, they have to go for medical examination. So what is required is, before marriage is performed, it is better to have a psychological examination of the bride and the bridegroom, where they can convey to the counselor and they can try to do something about it before marriage. Otherwise, both the lives are spoiled. Then
Yeah,
they become
we can avoid important people. We can avoid this type of already pre-planned cases.
yeah. And we can treat also.
Yeah.
After proper treatment, they can get married.
Yeah. So now this is a recent phenomena, sir. Recent phenomena, many cases.
Yes.
Many cases.
Actually, premarital counseling has to be given to boys and girls in colleges and schools.
Yes, sir.
+1, +2, or degree colleges or PG colleges, we have to give psychological counseling and clarify their doubts. Okay, then we should have a parents also meeting, parents teacher meeting also, where we have to explain such problems so that future disasters will not happen. Okay, fine. Yeah, I agree with you.
Or else the parents can also share the entire sexual advantages and disadvantages with their own daughters. That would
Yes, yes,
also help a lot.
yes, yes, yes.
Instead of
Because
carrying misconceptions. So
Yes.
better the parents can discuss, particularly mother. She can
Yes.
as well just discuss everything A to Z about sexual aspects as are concerned. That would also help a lot.
True, true.
Either parents or premarital counseling is most essential at this juncture. This is
Yes.
quite important.
Sure.
We can avoid important people. We can avoid already predetermined cases.
Yes.
Unnecessarily just going for marriage, waiting of lakhs of money, and just telling that and this fellow is having this, that all nonsense.
Yeah. The
Marriage is going to
correction-
perform in only once only, once in a lifetime only. That of spending crores of rupees also.
Yes. True.
Very, very, very sensitive, very, very, very important point, sir. This is most important.
Yes.
Premarital
Yes.
counseling is
Yes.
quite essential.
Yes, yes. Sure.
Sir, but in our Hindu country, we give respect to the traditions and all. When the parents or somebody else asks us to go to the psychologist for such kind of counseling, they think that this is not the right thing we have to go. Because, sir, I have a client who says that whenever she has some eye pain, she always cries that I lost my eyesight. When she has some stomach pain, she says that I have some cancer in the stomach. Like that for everything. So when the husband, I advise the husband, just take her to a psychologist, something like that. She says that, no, do you think that I am mad? Why should I go to the psychologist? So all her tests are normal, but she still, she says that I have that disease, I have this disease, something. So you better go for some psychological counseling so that they will tell how to be happy without all these things. She says that, do you think I am mad? Why should I go to a psychologist? Like that, she fights at home, sir.
Seeking the help from psychologists or psychiatrists doesn't mean they are mentally ill. This we have to spread the message to the community.
True, sir. True, sir.
Because you see, psychologists are involved in training managers, training police officers, IAS officers, IPS officers, management trainers, they're all psychologists. So similarly, it is only a kind of upgrading of the human ability, okay, talents and regulation of emotions. So it is more developmental and more of preventive. And if at all there is a breakdown, we can repair it also. We do not think that anybody who goes to a psychologist is a breakdown case. Okay, that is a age-old tradition. So we can change that by creating public opinion to going to schools and colleges. Then the news will spread.
Yes,
Again, television talks, radio talks, and writing in newspapers and magazines, where there can be question and answer. Okay, people can ask questions and we can clarify. So this is also the PR work has to be also done. And even educated people are not aware because it is not there in the syllabus, including the medical faculty. Okay, sex is not part of the syllabus. Delivery is there, disease is there, but not sex. MBBS or MD, it is not there. In psychiatry, it is not there. So that is the sad state of affairs. So
yes,
what required is people have to know about, they should become curious, and some of us must be able to answer all the queries.
yes, sir. Yes, sir. It is 100% true what you and Professor Reddy sir have been telling us. This is the need of the hour. Premarital counseling is the need of the hour, so that we can at least reduce the divorce cases, sir.
Yes, sure.
To some aspect.
Yes, definitely.
Sir, may I?
Or else the so-called psychologists who are in the society, they can as well go to the educational institutions as Professor Ganesh sir suggested. From
Yes, sir.
high school, 9th, 10th onwards, or intermediate onwards, and degree college, we can also cover, PG college, we can also cover. We can give, being psychologists, now so many trained psychologists are there. So they can as well go to their respective institutes, at least one program per 2 months. They can give some kind of awareness as far as this types of, so that we can give awareness and we can avoid the expecting problems. That is my appeal
Sure,
just
sure.
to psychologists.
Sir, Ganeshan sir,
Sir.
Yes,
Ganeshan
please.
sir,
Yes,
can I add some points, sir?
yes,
Sir, ma'am said no, that one lady is complaining all pains and something else. Though physically diagnosed, but she's feeling a stomach pain or headache or something else, eye pain, or I think it might be hypochondriasis, it seems.
yes.
Then who is eligible, sir? Either psychologist or psychiatrist to treat that case?
No, after the medical examination, they can be referred to the, if there is no pathology diagnosed by the medical expert, MD, then there is the functional illness, so they have to be referred to a psychologist. If there is any organic problem, they will treat. If there is
Okay.
no organic indication, then
Yes.
naturally it is a functional illness, it will be referred to the psychologist.
Okay.
And we
Actually,
also,
sir, absolutely, she has no health problem, no health issue at all, sir. Just a minor headache. She complains that my head is breaking. I got maybe brain tumor, like that. For everything, she creates a havoc in the house, sir.
okay.
Ma'am, that itself is called hypochondriasis, ma'am.
Yes, yes.
The feeling
Yes.
of all pains and all diseases, though they don't have, though they are not diagnosed, but they feel like so. That is called fibromyalgia or hypochondriasis. That's why I'm asking how to treat that cases by the psychologist.
Yeah. You see, for example, you have to interview the lady as to what is happening at home,
Yes.
whether she is getting love and affection from the husband or not, from
Yes.
the in-law. Otherwise, she will take some illness and act as if she is suffering, and then
Okay.
she will take rest.
Okay.
Because if the doctor says there is no origin, there is no pathology, then still if she is complaining of neck pain or chest pain or back pain, that means she is trying to escape.
Okay.
Because maybe it is too much of stress, or she is being hurt by the in-laws or by the husband, and
Okay.
she takes recluse into the disease. So
Okay.
that can be solved. So what is important is basically we should not diagnose and label, but
Okay.
we should act like a police inspector who is
Okay.
investigating the case from all angles.
Okay.
And
Okay.
interview everybody at home,
Ah.
husband, parents, etc. Then we will have a total picture.
Okay. Okay.
It is just like a scanning the
Okay.
whole body, scanning. They say we have to scan the whole family.
Okay.
Then we will know what is happening, whether she is lazy and escaping and malingering and cheating, or whether she has too much of stress. Then if
Okay.
that is the case, who is the stressor? How you can make the person not to create stress for this lady,
Yes.
like that. Okay.
Right, sir.
That
Thank
can
you,
be
sir.
done. In every
Thank
case, we have to take a total bird's eye view of the family.
Okay.
Where
Okay.
pressure is coming, like that. That will help.
Okay, sir. Okay.
Sir, may I ask a question?
Yes, Dr. Rao.
This is in regard to, I know these days there are too many advertisements in regard to this orgasm, in which, males have to use so many drugs and so many other things like Viagra and etc. So what are the psychological effects of the whole thing and how that can be prevented? If some people have got used to that kind of a, usage of drugs. And especially these days, they say you can increase the size and all kinds of things are coming up.
Yes.
So, which are detrimental.
Yeah, yes. No, that's a very interesting question Dr. Rao has asked. There is no relationship between the size of the penis, the the thickness of the penis and orgasm. What is important is the erection should last long enough to create at least single orgasm to the woman. Okay, otherwise everything is commercial. People want to sell some cream and tablet and things like that. Okay, and it is purely psychological. Okay, and nothing to do with biochemicals. So the drug industry will not be able to help. Okay, now one thing I suggest in any problem, not only orgasm or erection or impotence, people should act slowly, very, very slowly, with a lot of awareness. If they do things very slowly, I would give an example. If you take a badam kheer, you have to slowly sip and taste and swallow. You should take enough time to take it. You should not just gulp it. Okay. If you want to smoke, smoke slowly, enjoy the smoking. The brain will say this is nonsense. You will give up smoking. Similarly, alcohol, take sip by sip and enjoy and drink. You cannot become an alcoholic because the brain will say stop this nonsense. But what is happening? People go on having chain smoking or drinking. They say I can take 2 bottles of beer or 3 or 5 and all that. They have become addicted to such things because they are doing it mechanically and it becomes a habit. Okay, so they compete with colleagues and say, let us see who drinks more beers or whiskey or whatever. Okay, and that is not right. If you want to save them from smoking or drinking or sexual obsession or hesitation, ask them to engage in every activity in day-to-day life, like taking a coffee, to taking food, okay, and walking. Do it slowly and then experience the walking. Experience the sensation in the feet, okay. If you do everything slowly, then right things will remain, wrong things will be dropped, including sex. If people do sexual activity very, very slowly, experiencing that part of the area, whether vagina or penis, experience that, then they will drop the wrong thing and they will pick up the right thing. But what they are doing is either they back out or they engage in it like a machine. Okay, and that's a whole problem. Okay, so this is my suggestion. It is very simple, very effective, but you have to monitor and say whether they are able to do it slowly. Okay, time is the indicator. You ask them to go to your room and have sex and come out, how much time they have taken. Ask them to double the time. Okay, again, ask them to double the time. Then only they will slow down because it is a habit. So if you ask them to expand the time, double, then only they will know it very clearly. They have to experience. Without experience, anything, they will get addicted. Whether smoking or coffee or food or obesity. They are eating mechanically. That's why they have become obese. Anything they do.
But one issue here is if somebody is already using some kind of a drugs for prolonging the sexual pleasure, then how to stop that to start with? Because he may not like to slow down by stopping it because he got used to it.
You give them the
So he can be told to stop it and then go ahead with it.
Yes, without drug they have to try because the natural system will work, but they are overloaded either with the nicotine or with alcohol or with LSD, like that. So you should tell them, drop that and do it slowly. And the natural system will come up. It is just like a liver. Even if it is damaged, it will regenerate. That's it.
Yeah, okay. I got it. Thank you.
Welcome.
So may I, it's Mercy here.
Yeah, Mercy, yes.
Yes, sir, as you said, like, see, like, with the other people, like premarital sex and all is fine, but how about these divorcees? Like, I've got one case wherein she's divorced, But the thing is, she cannot get in with another relationship, but she wants to. And the problem is she thinks that she can have a friendly relationship, but not only with this sexual thing, cannot have it. And she is too confused that she came in like for counseling, but I was like, okay, just take it slow and steady and give it some time. But she's like, I need someone, but I cannot have I cannot get into a sexual relationship.
She is a divorcee?
Yes, sir. Yes.
She is a divorcee, okay. And then she doesn't want to marry again?
She wants to marry, but again, this one, she is a bit too, she's like, ma'am, I just want to have another person in my life. But when I think about the sexual kind of a thing, I am like, I cannot, it's disgusting, that kind of a feeling she has.
Okay. That means she is aversive to sex. Maybe that is why she went for a divorce in the first place.
Okay.
And that is why she doesn't want to have another marriage.
To this, sir, the divorce was actually based upon an extra affair of the husband. And it was not the first time, it was like multiple affairs. So that one has actually contributed.
A wife who is aversive to sex, naturally she will distract the husband and she will go outside for external relationship. In fact, she was the cause. She is also the cause. Okay, but if she doesn't want to get married again, that means she has an aversion to sex, which she can overcome. Okay, first of all, she has to overcome the aversion to sex. Okay, and check whether she is a lesbian.
Okay. Okay.
Whether she had any kind of sexual trauma as she grew up from the age of 5, 10, 12, etc.
Okay.
You have to give her self-defense technique, then she will be able to come out from the aversion to sex.
Okay.
Next, the genital muscle relaxation, which I have described, can be given. Okay?
Fine. Okay.
So this should go in this order. Self-defense technique first. What I am telling, in that order it has to go.
Okay, sir.
Then finally ask her to lie down, bend her knees, keep her thighs wide, knees wide, and ask her to contract the genital area quickly. Contract and release, quickly. Then she will get sexually excited. To create excitement in sex for an unmarried girl who is refusing to marry, or a married woman who is aversive to sex, or things like that. Ask the lady and do this exercise of contracting and releasing quickly. 1, 2, 3, 4, 5, 6, 7, 8. Then what happens? The sexual excitation comes. The nervous system from the brain to the vagina gets reconditioned, and she will be excited and she will agree to marry. Suppose a girl is not liking to marry for up to the age of 32 or something, ask her to do this exercise. She will agree for marriage.
Sure, sir.
She will also agree for a marriage. Or a married woman who is avoiding will also cooperate with her husband, and she will enjoy. And by doing this exercise, anorgasmia can be treated. She will start experiencing orgasm.
Okay. So how about on the other way around, women having an extra affair? How does that contribute? When we speak about it, when you said men having an extra affair, you said, okay, women contributes. How about another women having another extra affair?
No, it means there is a sexual incompatibility between the couple. The man is not able to satisfy, or the woman is not able to satisfy. So that has to be treated. Man has to be treated, and woman has to be treated. Man should know how to prolong the duration of erection, and woman should know how to enjoy. Okay. That is what is known as cold turkey syndrome. But the technique which I recently told, if it is done, women will start enjoying sex.
Okay, sir. Okay, sir. So are there any cases when I say you said incompatibility, can there be anything apart from, even when they are fine also, is there any cases there can be some reasons for some extra affairs and all?
No, there is no possibility of extramarital affair if both of them are compatible sexually. The man is
Okay.
able to perform well, and the woman is able to enjoy and have the orgasm, multiple orgasm. She will not need anybody else, and the husband will not need anybody else. Extramarital relationship can be solved. Even if it is there, it can be corrected by these methods.
Okay, sir.
The marriage can be restored from divorce.
Sir, another question, sir. Actually, wife and husband, a couple married for 25 years.
Okay,
Earlier, they had good sexual life. After wife coming to know of extramarital affairs of husband, she stayed away from husband for
okay,
around 10 years or so.
okay,
And once again, see, she is very much attached to husband that she can't have any other affair or anything like that. So she
okay,
wanted to have sex with the husband only.
okay,
But what he says is, as you made me stay away from you for a long period, I'm not interested in you and that I'm not ready to get engaged with you.
okay.
But this lady, what she wants,
Yeah,
I tried all the techniques which you told, sir.
okay,
But even what she says is that even I applied all those techniques. He's not
okay,
ready, madam. He's not ready to come for the thing with her.
okay.
Still
No,
he's refusing.
yeah, it becomes an ego problem. He feels hurt being deserted by the wife, and he wants to take revenge. Okay,
Okay,
but
okay, sir.
is he having extramarital relationship?
Yes, sir. Not a single, multiple he has.
Okay,
Even
okay,
then, that lady, what she says is that she doesn't like to have any other thing. I mean, she's not interested in it. She's very much attached.
okay, okay,
Emotionally as well, that she
okay.
says that I want to be with my husband only and I want to perform with him only. So I tried all the techniques and methods which you told me, madam. Still he's not coming for that. So what we should do, sir?
Okay. What is his age, education, and job?
Education, he's a businessman, sir, and he's a graduate, sir. Graduate.
Okay. Age is
He is 52, so, sir.
52. Okay.
Yes.
You see, what happens with extramarital relationship or going with call girls?
Yeah.
They're not bothered about orgasm. They want money.
Okay, sir.
So if this man has money, he can buy sex. That is what is
Yes.
happening for him.
Yes.
And he has a big ego.
Okay, sir.
Okay. And what I would suggest is there
Yes,
is
sir.
a traditional technique known as if you can talk to him and if you can agree,
Okay.
ask him to do some parigara. Parigara means compensation
Okay.
to buy number of saris, okay, like 21 saris, and
Okay,
give
sir.
it to the pujari in a temple, who will
Okay.
give the sari to whoever women are coming there,
Okay.
he will give, okay, then he will become all right. Because he
How
has been undressing a lot of women, okay, who come for money or for sex.
Okay.
That he has to wash away that kind of karma by donating saris, which will be dressing women, not the same women. but
Let me add something, sir. Just that means he has kept a lady for permanent, sir. It's not like
Okay.
leaving.
Okay, okay.
There is another case as well. Though he's
That
having
is-
multiple relations, one permanently is set for him.
Yeah, anyway, multiple means what is the number?
That means yeah, what she says is he's having more relations, but permanently he has two permanently. That is the thing.
Okay, okay. Religiously speaking, he has gone out of control.
Sudharani, I
Yes,
object.
sir. Yes,
Simply
sir.
you are believing what the client says.
So no, sir. There are proofs. Let me tell you, sir. Without proofs,
You-
I
Did you
didn't
have-
agree, sir.
Listen to me. Did you
Yes,
have
sir.
evidences? Did you collect?
Yes, sir. Yes, sir.
Yeah,
Yes.
when the girl or the boy is not interested, her own husband.
No, sir. After listening to Ganeshan, sir, I concluded all those things, sir. And after coming to know of all those things only, once again, I came to ask Ganeshan, sir.
Yeah, once they don't like, they will attribute so many things.
No, sir. No, sir. It is not like that.
It is our bounded duty to ascertain the total data, but the real data, particularly
yes, sir. After
Tonight
collecting complete real data only, I'm talking to sir.
Yeah, why you are not? We are not simply believe on the neither on the girl or on the boy.
No,
They
no,
all,
sir. No, sir.
All people they bluff.
No, sir. After coming to know of the real facts only, I asked, sir.
Okay, fine.
Okay, sir.
Okay.
Okay.
Now,
Okay. Yes, sir.
first of all, he is a Casanova. You know, a Casanova is one who carries on with so many girls.
Okay, sir.
There was a film also, Casanova 70, like that.
Okay.
One guy goes on having sex with so many women, and cases are reported in newspapers also. Okay. One of the things is ask the person to donate. Okay.
Yes, sir.
7 sarees to the pujari of a temple, who will distribute it to women who are visiting the temple.
Okay, sir.
Then this will bring a cognitive shift from that person, and he will reduce his flirting behavior.
Is it that he has to give with his own hands, sir, or else only in the temple that he needs to give?
Only pujari will give, not with his hand. Not to his girlfriends. Not to his girlfriends. Will be given to the pujari. Pujari will give it to women who are visiting the temple as a vastra dana. Let him do the vastra dana. Okay, because he is a businessman, he can afford, and I think he will agree.
How many members? How many members shall I ask her to say so?
Minimum 7.
Okay.
7 or 9 or 11. Okay. Some odd number.
Okay, sir.
Okay. And see his behavior, because
yes, sir.
He has become unethical. Okay. This unethical behavior will come down. Okay. He will come from 4 to 3 to 2 to 1, and he will return to his wife.
Sir, is it that it can be given in the name of husband by the wife, or else he has to give by himself?
No, he has to give it to the pujari. Only pujari will give to people who are visiting the temple. They will not say so and so is giving this. He will simply give. This is a dana, vastra dana. He will give the dana to the pujari, and pujari will give to people whom he doesn't know. Okay,
So can I?
Yes.
Sir, can I ask a question? Get your time, sir. Good evening, sir.
Thank you, sir. Thank you.
Welcome.
So,
but there are some chances of getting some diseases also, no, sir, if he is having contact with so many people like that. Sir.
But you can ask him to use condom. If he listen to you, you can ask him to use condom.
Okay, sir. Right now, sir, what already happened, she can't change, no, sir, anyhow.
No, you have to do a correction right now.
Okay.
Now, how you are going to change the future? You have to be changed hereafter only.
Okay.
And he can consult a VD specialist, venereal disease specialist. He can go and consult, and it may dawn on him that he has to regulate his health. Otherwise, he will become a HIV patient. Ask him to go for a blood test.
What patient, sir? Pardon?
Venereal disease.
Okay,
HIV,
okay, sir.
HIV
Okay,
infection. Ask him to go for a Western blot test.
Okay, sir.
The doctors will tell him. Ask him to go for a blood test, VDRL test.
Okay, sir.
And if he is wise enough, he will follow your instructions.
Okay, sir. Thank you, sir.
Yes, please.
Good evening.
Okay. Yes, Dr. Venkatalakshmi, tell me.
Good evening, sir. My name is Venkatalakshmi. I am Venkatalakshmi. A girl come to me. She is a girl with OCD. She says she does not want to marry and she does not want to children because children having painful and she says she says does not to have any sexual feelings. What is the solution, sir?
What is the age?
24 years, sir. 24 years.
Age 24.
Yes, sir.
Okay. Education?
Engineering, sir. Engineering completed.
Okay. Okay. You know, if you can become a Swamini, if that is the case, ask her to become a Swamini in an ashram. That is also a solution. And then she will say, I don't want to become a Swamini. Then you become a Grahasti. Then we can give some solution. Okay. Because if they are motivated to become a Swamini, it's a good thing they do it immediately. Okay, what is their religion?
Hindu, sir.
Hindu, okay. Swamini. Christian means they can become a sister.
Okay.
Swamini or Jogini, sir?
Swamini. Swamiji, Swamini.
Yes, madam. Just we have wanted to put it. You came. You just asked question so that people may feel happy. Please.
So people may feel happy. Okay, sir. One last question. For 1 year, sir, she was married to her cousin. Cousin means her mother's sister's son. They were like until 13 and 14 years, they were like in the one joint family and they were playing, they were doing everything all like just like cousins and all. But suddenly she was asked that you will be married to that boy. And there was only 20 days of time and she has to decide, and after 20 days she got married. And the boy says he has the feelings for him, but the girl who is 24 did her BBA says that I'm not getting any kind of feelings towards him because I'm not able to accept him as my husband because I was not given time, and I haven't seen him as my husband from the childhood because we have been playing together and everything is happening, but I'm not getting any. I'm trying, I'm cooperating in all my ways I can do, but I'm not getting any kind of attraction towards him. But she had some crush in her teens, like in intermediate, but as they know that their family doesn't accept, she could not proceed in that. So she was normal, and she is like, men and women are equal. There is no such bias or anything. And now she is so that I'm not myself. I'm not myself, but I've been compromising for everything, but I'm not able to compromise in this aspect.
Actually, she is revolting. She is revolting with the parents' choice. After all, the marriage is over. Now she is revolting. Okay. One solution is go for a divorce. Okay. Or second is go for the sensate focus exercise.
Okay.
And that will solve the problem. Otherwise, if it is not solved now, she will have bad children and still it will go on. That's a problem. So that's why you have to give a clear-cut instruction. Either you go in route A or route B. You go for a divorce, okay, or go for sensate focus. And sensate focus will solve the problem.
Yes, sir.
Definitely. Because
she came to me without the consent of husband.
Okay. Okay. But you involve the husband also. Without that.
Yeah, I told him to come.
You have to involve the husband. Okay. And sniffing the body, touching, feeling.
Yes, sir. Yes, sir. Since I'm aware of it. Sir.
Yeah, please try that. Okay.
Okay, sir.
That will solve the problem.
Okay, sir. Thank you.
Sir, I have one small.
Yes, yes.
Yes, sir.
Yes, Dr.
Sir,
Kavita.
fine. Yes, sir. So one of my friend is facing this problem. She's been married for 15 years. but
Okay.
her husband doesn't have sex frequently, like maybe once in 7-8 months, and
Okay.
she's really depressed about it, and she feels a frustration. She tried many times to discuss with her husband. Then her husband says, yes, yes, from tomorrow I'll change. You'll see change in me. But again, from tomorrow, it's the same thing. So it's been happening since many years.
Okay. Now, I have already suggested one technique known as paradoxical intention technique. Ask both of them to lie in a bed together with a 12 inches gap in between. Ask the husband not to have an erection.
Okay.
You have to do it for 45 minutes. If he tries, he will definitely have at least one erection. And repeat it again the next day also. For 3 days, you repeat. Within that period, he will have an erection. The more he doesn't want to have an erection will come. And also ask him whether he is having early morning erections, which is usual in the case of men. That means there is no neurological damage unless there is some back pain or something like that. If there is an injury, then erection will not come. It is organic and it is a primary impotence. Okay. Second, you may have a secondary impotence.
Okay.
And that will be able to solve.
Okay. So secondary impotency might be the reason for the avoidance.
Yeah, we have to check. That is why if you give this test, if he is still not having erection, there is some injury in the spinal cord. That he has to seek the help of a neurologist. Lumbar spine 4 and 5. Is there any concussion there? That has to be examined. What can be done surgically to be decided by a neurosurgeon.
Okay. Thank you.
We have to work along with the medical experts. What is wrong in the body? If everything is okay, then something is wrong in the mind or the cognition, like that.
Okay, sir. Understood.
Sir, can I add a point here, sir?
Yes, please.
Sir, I mean, since I work with Dr. Samaram, he does all the scans and everything. So whenever he looks for the hormonal level also, when the hormone levels are too low, also there won't be any erections, even the prolactin or the testosterone. That could be also one of the reasons. That has to be ruled out also. That is what I can add.
Yeah. Yes, Dr. Ramadevi, the hormones are regulated by the attitude, the feelings, the shock, etc. Okay. So they are only indicators, but the origin is in the mind, the history, what happened, whether the person was sexually abused, whether he has developed an aversion to sex, then the kind of androgen production will be low. Okay. Like that. So you have to examine both ways. And the hormones are decided by the history of the person, how the person has taken his life experiences, how does he feel like that. So that should be also seen. So it should be an interdisciplinary approach.
Shall we conclude, sir?
Yeah, yes, please.
Yes. Sir, actually, this sexual therapy is a very, very, very interesting one. And but as far as this, just, having sexual relationship with husband and wife, there is a system in it. Young people see like there's some kind of gap, minimum gap, like that coming to age, crossing 60s. Just the timetable like that, some system planning is there, sir. Without knowing all this planning and everything, they're just clashing each other, and they in turn they are going to the police station. And in turn they are going to the police station people, police people. They will simply direct towards counselors. So this awareness, as a 20 years husband and wife, how many times like that? 60 years, then 70 years. There is a just some kind of method is there, methodology. I can say methodology. Yes. So if they follow it, I think they can minimize the problems. That is
Yeah.
my contribution.
Sure.
But as far as Sigmund Freud says, libido will be there. Libido will be there. But at the same time, when all said and done, everything have to be just, what Professor Sudhakar Reddy, he just we used to interact, we used to discuss. Immediately after having lunch or dinner, people are going for just starting of sexual relations. That is totally wrong, what he said.
Yes, yes.
I think
sure.
today he has not joined.
He has not joined. Yes.
Yeah. See,
Yes,
the real time, the actual time period is after 3 o'clock. After 3 o'clock, what all we just had the food. So that will be just digested and everything it should be just released in the form of hormones. Then, as you said, the early morning, there is just erection. So naturally, when everything, that total process from night 10 o'clock to till 3 o'clock, the process is there. And just as they should wait. And the total process is being carried out. And automatically, then erection will be there, a libido will be yield, but not everything. Then that is the real time. Ideal time. So here, without knowing all certain things, simply this is not a just a friendly match or a cricket match. So it is everything, a system is there.
Yes.
But the counselor should also be aware of this just system.
Yes.
That's why I used to tell, family counseling means only married people, that too, who are living each other, they are leading a fruitful life. Such people, those who are crossed 50 or 60, they are eligible to extend counseling, family counseling to the couples. Tom, Dick, and Harry cannot do it.
True.
So that's why at least training, attending to this type of trainings, they plays a major role.
Yes. Definitely.
Very sensitive issues are counseling. All people
Yes,
cannot do it.
Yes, yes. That's
Right, sir. Yeah, anyway, shall we? Okay. Just it is a kind of a contribution awareness, just to the counselor. Okay, madam.
What Professor Reddy is telling is, after food, immediately, if you try for sex, erection will not come, because the whole blood goes to the stomach, and brain also will not have blood. The whole blood goes to the stomach. Okay, the penis will not have blood. So after the digestion is over, at least 2 hours after taking the food, after that only body gets balanced. So if somebody is trying immediately after dinner, they will have difficulty. That's what he has told.
Yeah, and moreover, I myself counseled one case. I don't know, he's a big officer, and this madam is a housewife.
Okay.
Even during night also, that fellow will not be having sleep. That is number one problem. Because, all the time she will be pinching, craving for sex. But it is not a machine. So, okay, fine. That fellow, he tried his best and fulfilled his job. Then, the moment he starts going to the job, again, he just catch hold of his collar or shirt, brings him back to the bedroom. Oh, you start. So this is a peculiar case, and he just cried like anything. He went and reported to his higher up also. So what type of problem, sir? Is there any deviation or some kind of abnormality as far as that woman is concerned? Kindly clarify.
Yeah. You see, if somebody is addicted like alcohol or cigarette or sex, they want to do things fast. So ask her to slow down her participation in sex. Ask her to breathe slowly in and out, move her body slowly in and out, not mechanically move the body, because she'll be moving the body mechanically. Okay, a man will also move the body mechanically. Slow it down, then things will become all right. Otherwise, again, she will want more. Okay, and that's the problem. Catherine, the great Catherine is a Russian empress. Okay, she wants regular supply of men. Okay, because she is in power. And one thing is, women do not require erection. Man requires erection, and only after 1 hour he will have the second erection. But a woman is always ready. Okay, that is why the brothel house, woman is ready all the time because it is opening. Okay. Whether she experiences orgasm or not, she has to do it and she can do it. Whereas a man cannot do it because the system requires recouping. It takes at least a minimum 1 hour. After that, only he can have second time. Okay. These are some physiological aspects.
Yeah.
Of, yeah.
Okay, sir. Thank you, sir. Thank you.
Yes,
Yes, Ramadevi.
Yes,
You
sir.
just extend thanks, because you came late, you cannot summarize. Just the people will get summarized through when we upload it to YouTube.
Okay, sir. Oh, I just listened a couple of cases, sir. That's all.
Please, you just kindly.
Yes, sir. It's a case about a 25-year-old, 25 years of marriage. Husband has extramarital lives, and the wife was away for a certain period of time. So when the wife wants to approach him, he's denying it. So the solution is he has become egoistic and tried to take the revenge on his wife, and he's not worried about his orgasms. So the better way is to ask him to buy 7 to 21, any number in between, odd number of saris, give it to the pujari and in any temple, and donate them to the woman who visits the temple, just like Vasradhanam. So if he has to take care of his STDs, sexually transmitted diseases. So a girl who doesn't want to get married or have children, doesn't have any sexual desires. So give her the option as to become either Swamini or Gruhasti. So only two options are there. So she has to decide. So they either go for divorce or with the help of a husband, go for sunset focus. So the person who has been married for 15 years, couple who have been married for 15 years, they are hardly having any intercourse, like once in 7 or 8 months, and the wife is depressed. And in spite of trying many ways, still the husband is not coming close. So the paradoxical intention technique will work. So we have to make them lie on the bed with a 12-inch gap between them and ask the husband not to have any erection. So there might be any secondary impotence and diagnosed for any organic problems, just like lumbar spondylitis or anything, or to find out if he has any early morning erections. So lying on the bed and with a 12-inch gap, that intention technique, we have to do it for 3 days. So we have to work, if it is like any issue, we have to work it with the medical aspects, like with neurologist or a sex specialist. So in any case where the women or husbands are getting aroused and are having severe desires, then they have to do the slow breathing, and the moment everything has to be slowed down. So this is only what I have noticed. Yes. So I thank you, Professor Vedagiri Ganeshan sir, for his enormous patience and tireless patience, been putting it every day. So in spite of being his age, he's so passionate in responding to each and every question with a smile on his face. So we are very grateful, sir, for you to have us with us. And I thank you so much from your bottom of the heart on behalf of WCOP and the participants. We are getting the practical solutions. Even when the problem is so complex, you give very simple solutions. The solutions are very simple. And I always remember your saying that for every problem, there is a solution. So we have to look for the solution rather than practicing the problem. So thank you so much, sir. Thank you, BJ Reddy sir, for giving us this such a platform to enhance our skills. And I also thank all the participants who have been regularly participating in this program to enhance or enrich their experience and help the couples or the people who approach them. Thank you so much, sir, and have a pleasant evening.
So thank you. Good night, everyone.
Thank you, sir.
Good night, sir.
Thank you,
Good night,
sir. Good night,
everybody.
sir.
Thank you, everybody.